There is way too much hype and misinformation surrounding this novel coronavirus, and I want to talk about it on this week's Wednesday Checkup. Let me start off by thanking each and every one of you who sent me an email or message convincing me to make this video. I didn't need any convincing. I just didn't want to make this video too soon because I didn't have enough information to give you practical, useful guides. Even now, there's still a lot that we don't know, but I'm going to be talking about that throughout this video. Let's start off with that term coronavirus. There are many different types of coronaviruses, different strains. In fact, the common cold that you and I get can be caused by a coronavirus. Now, what's going on in Wuhan, China is a novel coronavirus. It's not the one that causes the common cold. What makes it novel? Well, that's because it's spread from an animal carrier to a human. The current thought is that it either came from a bat or a snake, and this can only happen if humans are in direct, close proximity with those animals. First, you have this animal that's infected with this novel coronavirus. It mutates, then enters a human cell, starts replicating within a human body, thereby infecting that individual, causing them to have symptoms. What are the symptoms of this novel coronavirus? The most common, fever, next is cough, next is shortness of breath. Just like the common cold or the flu, this virus spreads in the same way, through airborne particles, surface particles, or even close contact with other humans who are also infected. I want you to know that all the information I'm about to present to you here comes directly from the CDC or the WHO or the Department of Health. Usually they're all working in coordination together, but these are your main sources of information. Please don't think that if you read someone's tweet and it has been retweeted a lot, it's an accurate source of information. It is not. Look for reputable organizations to get your information from. Also, I'd like for you to keep in mind, all the statistics and all the information I'm giving you make sense right now. They're up to date to this given moment, but all those things can change. Tomorrow, there's going to be more individuals affected than they are today. We may learn something about the virus that we didn't know today in a week. So please keep in mind that this video is being filmed on January 28th, 2020. I want you to keep this phrase in your head: alert, but not anxious. This Wuhan virus or novel coronavirus is really a potential threat to us here in the United States and is not a crisis yet by any means. So again, alert, not anxious. So let's talk about some of the stats that we know now. Currently, there's about 4,500 individuals infected with the novel coronavirus throughout the world, with just over 100 deaths. The majority of these, the huge majority of these, are in China. In the US, we have 5 total confirmed cases, 0 deaths. Internationally, there are about 30 cases. Again, these numbers are going to change quite rapidly. This is just to give you a feeling for what's going on in this moment right now. Now, you may be wondering to yourself, is this a dangerous virus? Well, the answer is it depends. It can become severe in about 20% of cases, leading to pneumonia or acute respiratory distress syndrome, leading to ventilation or even death in some circumstances. For those of you who are living in the US, this is certainly a potential threat we should be on the lookout for. With all the international travel that goes on in the world today, it's very easy to spread a virus from one country to another. That being said, with only 5 cases here in the US, with 0 deaths thus far, this is not a crisis and not a reason to panic. There's been many headlines in media that are trying to scare you into panicking because it urges you to click. And when you click, they earn money. Do not fall for this. Look for reputable sources like the CDC or WHO. I'm going to keep stating that over and over again. There's still a lot of information we don't know about this novel coronavirus. How long it takes to spread. What is the true incubation period? Meaning that you have the virus, but you don't show any symptoms yet. Right now, we're thinking it's a week to 2 weeks, but we're still figuring that out. And then finally, can you spread the virus during that asymptomatic period, which would be really dangerous because you could have individuals who are not sick actually transmitting the virus across the world. In fact, when we had a similar outbreak like this in the early 2000s with SARS, the reason we were able to contain it was that we were screening people to see who had a fever, who was sick with this virus, and we were able to contain and isolate those individuals. But if this virus can be transmitted even when we're healthy, or at least seemingly healthy, that can be quite dangerous. We don't know the answer to that question yet. When it comes to treatment for the coronavirus, I'm sad to say there is no treatment. That doesn't mean we can't do anything. We can still give supportive care. That means if you're dehydrated, we can give you IV fluids. That means if you have a very high fever, we can give you antipyretics. If you can't breathe on your own, we can put you on a ventilator. So there are certain things we can help you in a supportive manner, but there's no direct treatment. Because for example, if you had a bacterial infection, we can give you an antibiotic. That's a direct treatment. There are some companies that are working on treatments for this and are hoping to make progress very soon, but it's not going to be done in the next few weeks. Also, the NIH did announce that they're working very quickly on a vaccine for this. They're hoping to develop this within the next few months to have it ready for us in case this truly becomes a worldwide pandemic. Let's talk about what to do if you're worried that you may have this novel coronavirus. First of all, you would have to have been exposed to someone in China, like you had to be in the Wuhan area, or have been in contact with someone from that area within the last 2 weeks. Otherwise, it's highly unlikely that you have this virus. But let's say you are still worried. What's the first thing you should do? Call your healthcare provider before going to get care. Why? So they can prepare the waiting area, that they can isolate it as best as possible, take you through the proper protocols to make sure that those who are susceptible are out of harm's way, because you don't want to get people sick if you truly do have this virus. Next, they'll ask you a series of questions to see if you meet the criteria for further testing. If you do, they'll send out a sample to the CDC headquarters in Atlanta, Georgia. That test takes about 24 to 48 hours to complete. It's called the PCR test. During that time, you'll stay in an isolation area in the hospital, which is usually a negative pressure room to prevent the virus particles from escaping. Again, whether you have the novel coronavirus, the flu, or any other virus, the treatment remains supportive care. We're gonna do everything in our power to make sure that your body's immune system can fight off whatever virus is affecting you in a given moment. In fact, what we're doing with all our patients in the hospitals and primary care offices is when someone comes in with symptoms that mimic the novel coronavirus, we do ask a thorough travel history. If they've been to China, do they have any friends or family staying with them that came from China? These are important questions that we need to ask. In fact, this screening protocol has actually increased in the United States to 20 airports. Here's some practical advice to keep you safe from this novel coronaviruses and any other infections that are out there in a given moment. It is flu season after all, and the flu virus is also very dangerous. Number one, stay alert but not anxious. I've said it before, I'm saying it again because I do not want you to panic. Panic yields false alarms and that yields bad outcomes. We don't want that in this case. Two, do not travel to China or the Wuhan area unless it's absolutely mandatory. Three, if you were in China within the last 2 weeks and you're experiencing fever, cough, or shortness of breath, please contact your healthcare provider as soon as possible. Four, make sure to wash your hands frequently throughout the day. That means 20 seconds with soap and water. If that's not available, you can use an alcohol-based hand sanitizer, of course. Five, do your best in avoiding touching your mucous membranes. That includes your eyes, nose, and your mouth. These bad boys right here are the most common areas for infected particles. And then when you put them on your mucous membranes, that's how they get in your body. Six, if you're gonna cough or sneeze, do it into a tissue and then throw that tissue out. Seven, clean high traffic areas. If you're gonna be using a public workspace, wipe it down first. It's a simple rule of thumb that I like to recommend to all of my patients. Eight, do your best to avoid contact with those who are sick. If you see someone coughing or sneezing, do your best to keep at least 6 feet in between you. That's generally how far sneeze and cough particles can travel. 9, if you're sick, please stay home. It doesn't matter if you have the flu or the common cold. By staying home, you're decreasing the spread of that virus, you're decreasing viral load, you're making the community safer by staying home. I know we all want to be more productive and get to work, but you're not going to do great work when you're already sick. A lot of folks have been asking me questions about wearing surgical masks in public, whether or not that's beneficial. There can be some benefit there, but there could also be some harm, because when you're taking the mask off, if you get some of the germs on your hands, then you shake hands with somebody, now you're spreading that virus further. So there's kind of pros and cons in both directions. The CDC is not making this general recommendation that everyone in a public place should wear this mask, and I think we should stick to that advice. If we don't need to wear them, don't. Because the masks that we wear in the healthcare environment are N95 masks. These are fit tested masks. They have a very specific method of working, and the regular surgical masks that you see people using, the disposable ones, those don't offer a huge amount of protection. Just remember, because this is a developing situation, details are gonna change. That's why I'm gonna link really good quality sources from the CDC and the NIH down below. Click on those for further reading. If you have any questions or comments, leave them down below. I'm gonna do my best to stay as active as possible in the comment section, answering your questions in case the situation changes or develops further. Here's a good playlist if you'd like to learn more about some really cool medical cases. And as always, you're gonna stay happy and healthy when you click on one of these.